Making sure it's all working.
Yeah, we're a test run.
All right, says we are live. Let's peep all the platforms.
And you're okay with these angles now? Oh, I just changed that. Was that bad?
Um,
I just centered us on this screen.
nah, you're chilling.
Okay. So if you see us right now, we're just barely getting started. It's going to be an awesome live. We're 5 minutes early currently, but we're just working through all the technology stuff to make sure that we're live on all the major platforms. So we'll be on Instagram, TikTok, and YouTube.
Okay.
Facebook is live.
Oh, Facebook. Sorry,
Yeah.
Facebook.
It's live.
Yeah.
Facebook
And
is
YouTube's live.
Instagram's not.
So this almost always happens. It's Instagram that's the problem. So it's good that we start these about 5 minutes early, just so we can make sure that we get everything
I'm
rolling.
gonna get a new stream key just in case. I'm gonna just run it back.
It's so helpful to have somebody do this.
Oh yeah. So to have
We
a
pay the good
whole
money to have this whole
media
team.
team, and they film our content and they edit the content. It's really
We can
nice.
keep our local staff lean, but also have someone to support us on the things that we all can't do.
Yeah.
I could probably troubleshoot this. It'd probably just take me twice as long.
Right,
They do it every
right,
day.
yeah.
Okay, it's on now.
So it just said it was
Perfect.
live, but then it just
Oh, it disappeared.
So if you're watching this right now, we're not officially started yet. I can tell we got 5 people joined. They're probably all the people that work here. But if you're seeing this, we'll get started here in just a couple minutes.
6 is more than we've ever done.
We're just getting live on all of the major platforms right now. So I think Facebook's up, I think YouTube is up, and the team right now is working on getting us live on Instagram. So anyway, we're super excited. Today's going to be a great conversation. We're going to spend about an hour, and we're going to talk about all things related to full mouth restorations.
Yes.
3-on-6. And so I'm super excited with the special guest we have today. And I'm not going to introduce her yet because I don't want to spoil it. And IT is in here working hard. Jason, thank you so much. Like the wizard behind the curtain, the Wizard of Oz.
Well, we got 7 people already in here. Let's
Yeah,
go.
let's go. All right, so we're just about ready to get started next couple minutes. So I think we're live on Facebook, YouTube, and Instagram shows a green check mark on this side. So we'll let it load up for a second. That can be a little bit slow.
Because yeah, it started living as soon as you reset to the new one, so I think it's really slow.
Yeah.
Maybe it's just delayed. That's all right. Beautiful day here in Las Vegas. It's nice to be out of the heat.
Yes,
It's
it is.
like 100 and something today,
Yeah, I think it's like 106.
That's
what I
pretty
saw.
hot.
Yeah.
but not in here. In here, it feels really
in
good.
here. Yes.
They always crank up the AC for me, so
They
that's
have
always
leaves.
nice.
We're fanning them with leaves, giant leaves right now.
Giant leaves. That's right.
Hi, Jennifer. Is that you?
Oh no,
That's none of us,
that's
that's somebody.
Okay.
hi.
Hi, Jennifer.
We know who that is. That's awesome. So we'll get live here in just about 30 more seconds. We're just getting the rest of the platforms up and online. So our goal is to be live on Facebook, on YouTube, and Instagram simultaneously. Hi, how
Hi,
are you?
Claudette.
You're so good at reading everybody's names. You're so
I know.
attentive.
Know
Know some of these people?
I know some of these
That's
people.
awesome.
I do.
Your
Yes.
your fame is attracting people onto the
Stop
live.
it.
You're a mega star. I actually wrote that on a thing today. Okay, so good news. We are officially live on all platforms right
Oh,
now.
amazing.
So
I love
Facebook,
it.
YouTube, Instagram, we're ready to go.
Hi, Rob.
Hi, Rob. This is so fun. Okay, so what we're going to do, obviously, if you've joined, you know that I am Dr. Emett here in Las Vegas. I have a dental practice here called All Out Dental, and we're a full mouth rehab office, and we just do what's called the 3-on-6 procedure. And so I'm super excited today because my special guest has a wealth of experience in everything related to full mouth, not just the 3-on-6, but really has an amazing story, an amazing journey.
Yeah.
And she is very well known on the 3-on-6 platform, we would call it. I love that everybody knows you. This is so fun. So the fun part is if you are a member of the 3-on-6 Facebook page, they probably know who you are
Yes.
because you're commenting all the time.
Yeah.
You're in there, you're very active, and you're helping people get answers to questions they have, right? So without any further ado, this is Miss Stephanie Saunders, live in person in the Glendale studio in Las Vegas, Nevada with All Out Dental. So welcome. I'm super excited you're here.
I'm excited to be here.
This is amazing.
Very excited.
You called and said, hey, I'm coming to Las Vegas. Could
I
I
did.
come to your office and meet you?
I did.
And I
Yes.
said, more than that, would you come on my show with me?
I
And you were so generous.
loved it. Yeah, I was like, wow.
Yeah, that was so fun that you're willing to do it. So what I thought would be fun is if you would just introduce yourself and just tell us a little bit of your background,
Okay.
so that maybe the people who don't know you can get a chance to get to know you a little bit.
Okay. I'm Stephanie. So I have a support group online. I actually started my journey back in 2017. Didn't start with 3-on-6, but that's where it led to. I'm grateful. But I have a support group online that just does general support for people that are having issues with their teeth. And it's
So I'm going to pause you. What's the name of this support group?
it's
I put you on the
Did-
spot.
dentures and dental implant / denture support group.
Okay. All right. I didn't mean to interrupt you.
That's
You're doing
okay.
so good, but
So-
I want people to hear what it was called.
Yeah. So I actually started that back in 2017 when I started having issues with my teeth because I was a nervous wreck.
Hmm.
Anybody that knows that they're about to lose their teeth, it's like, where do you start? It's very emotional. So I wanted to provide myself some support while also supporting others going through this. And it just kind of grew from there. And that's how I met Dr. Roberts and discovered the 3-on-6. So there was actually a couple patients in my group that had the 3-on-6.
Oh,
And
nice.
that's how I learned about it. And I thought, what is this procedure? And it kind of went from, yeah.
So you have the 3-on-6 procedure personally.
Yes.
You
I do.
have 3-on-6 beautiful teeth.
Yes.
And let's give a big, beautiful
Yes.
smile because look at her teeth. Oh my gosh. And I can tell you in person, they're even better looking than they are through the camera.
I love my teeth. I do. I didn't start with the 3-on-6. I started with an upper denture and then went to a upper snap-in denture and then went to the 3-on-6, which I mean, going through that, I've been able to help a lot of other people not to make the same mistake as me. Like, don't do the denture or, just go straight to the 3 because you're wasting money, really.
Okay. So two thoughts that came to mind just barely. How many members are there in your support group?
So there's about 15,000, I think.
15,000 members in her Facebook support group.
It's
Wow.
it's really grown.
That's incredible.
It's really grown over the, I guess, last 8 years.
That's really incredible.
Super thankful and grateful. The members are incredible.
Yeah, that's so neat that you have such a broad reach of people that you're helping. I love that for you. I think it's really cool. So I wanted to ask you a question. You mentioned that you went into a denture. How long were you in a denture for?
I was in a denture for about a year.
About a year.
So what happened is I went to a local provider and the goal was for me to do mini implants at a snap-in denture. I had the teeth extracted, went into a temporary denture, and then he retired kind of out of the blue. Well, no, sorry. I had the teeth extracted, then I had the implants put in. And when I was going in to start the process for the snap-in denture, I found out that he had retired.
Okay.
So that kept me in a denture for longer.
Okay.
So I was in the denture for a year, then went to the snap-in denture. I had that for 2 or 3 years, and that's when I discovered the 3-on-6.
Okay.
So
We're going to talk about that in a second. We're going to come back to that, but I want to back up even further to something you said a minute ago. The idea of having all of your teeth extracted.
yeah.
It's emotional.
Oh my gosh.
Let's talk about that. Because I don't, it's hard for me to tell patients what that is like, but you went through it.
Yeah.
Talk to people about the idea of needing teeth extracted.
I mean, I had kind of went through dental issues. I had dental issues all my life, with just having cavities filled and crowns. But when you start losing your front teeth, and you can't smile, it's hard to explain. Like, oh my gosh, what am I going to do? Like, how am I going to eat? First of all,
Yeah.
How am I going to eat? Second of all, like I have to work and provide for my family, and like, oh my gosh, what am I going to do? But yeah, it's very emotional, and I really didn't have a fear of dentists, but there are a lot of people out here that do.
Oh,
So
yeah.
that just adds to it.
Totally. The first time a dentist told you, hey, we need to extract all of your teeth, what was that conversation like?
I was upset. I was mad at him.
You're mad at the dentist.
I was mad.
Okay.
When he told me I had to have all my upper teeth extracted, even though he knew what he was saying, I was upset.
Yeah.
Like, I didn't want to believe it. I walked out of that office and I'm like, I'm going for a second opinion. There's no way this is happening. Yeah, I was pissed.
That's fair.
To put it lightly.
That's a hard conversation.
Yeah, I was really upset. So yeah.
So you ended up with a snap-in denture. Just talk about the experience with a snap-in denture. Tell everybody what it is, and then talk about the experience of having one.
Okay. So a snap-in denture is a removable, it's a denture, but you have implants in, and the denture secures to the implants.
So like every morning you snap it.
You snap it in and out. Oh, yeah, you have to take it in and out for cleaning. And I'm going to tell you, I loved my snap-in denture.
Okay.
I'm not going to lie to you. It gave me my life back.
And it's so much better than a non-snap-in denture.
It is.
Because it's stable.
It is. It is. It did the job. It was nice looking. Yeah, I didn't have to deal with glues and stuff. And so I didn't have an issue. I really didn't. If we're being honest here, I didn't have an issue with the snap-in denture. It just got to a point where I think 1 or 2 years into it, I had to go and have the thing relined.
Okay.
That cost me, I think, $800 or $900. I had to have the band. It was getting costly. So I'm like, okay, I like this snap-in denture, but am I going to have to continue putting money out to keep this thing functional?
Yeah.
And so, I mean, and at first that was my life, and that's what I had to do.
Sure.
So, but
and let's talk real quick about why dentures in general, even snap-in dentures, have to be relined. It's because the bone height decreases when it's not supported properly.
Yes.
So the bone height decreases, the soft tissue, your gums decrease, and it creates a little gap between the denture and your gums.
And I had mini implant. I chose to do mini implants, and nothing wrong with them. But I guess, and you'll have to correct me here.
That's okay.
Anywhere that you don't have implants, you're going to lose tissue and bone.
Correct.
And these mini implants are so small that at first the denture was really secure, but then over time, my gum really started to shrink. And I thought, this is not what I expected, or not really what I was told. I didn't think this would happen.
Okay.
So my mouth continued to sink, and I'm like, okay, wow.
There might be a better option out there.
There's got to be a better option than this.
And
yes.
you actually heard about 3-on-6 from your support group.
For my support group.
From other patients who had the 3-on-6.
Yes.
And now you're like, wait, what is a 3-on-6?
Yes. 2 patients in the support group, Wendy and Trisha.
Okay. And I happen to know who one of those people are.
You know Trisha.
Yeah.
Wendy had went to the Arizona office and had her 3-on-6.
Okay.
She was a big advocate in the group. And I'm like, wait a minute, let me look into this.
What is this?
Yeah, because that's kind of when it was first coming around to the support groups. And so then I looked it up and started watching videos. And then Trisha had her surgery.
Okay.
Changed her life.
Yes,
and so
it did.
I'm like, okay. And at first, I wasn't sure how I felt about it.
Okay. Tell us why. What do you mean?
Because, okay, so implants and bridges. I'm like, okay, how does this work without, because with me, my family has periodontal disease and our gums continue to recede. So I thought, how do they do this without the gums receding?
Valid question.
Like,
We get asked this all
how
the
do
time.
you put bridges in and keep the gum stable to where where it doesn't separate?
Okay.
Like, how does this work? So I wasn't completely sold at first.
Sure. That's a big question.
So,
How long have you had your 3-on-6?
but I've had mine for my lowers for 5 years, my uppers for 3.
So let's just ask the burn question, which is in my mind right now, but I'm sure maybe somebody who's watching, how are your gums right now?
My gums, it actually, it's helped stop the receding, really.
Yeah. So do your gums, it's kind of hard to do this live right now. I don't want you to put your fingers in your mouth, but are your gums still up around your teeth like they were in the beginning?
Yes.
Isn't that incredible?
Yeah.
And it's a hard concept to tell people. We try to show pictures all the time, all over our media platforms and websites. We show pictures, but it's a valid question for somebody who's experienced recession and loss to be in a spot where that can actually be stopped.
Right.
And
Yeah.
maintained.
Yeah.
That's so exciting.
And the 3-on, I mean, the FP1 3-on-6 has come so far along. And so I feel like you guys are constantly making improvements. And I feel like with each surgery you do, you get better.
Oh yeah, absolutely.
I mean, it's like, like every surgery I see, I'm like, that's incredible.
Yeah.
Those gums look amazing.
We do tissue Tuesdays, and the 3-on-6 providers, we brag about soft tissue cases that we do, and we just show pictures even to each other to help us all even get better at maintaining that soft tissue. But I see questions all the time on the 3-on-6 Facebook page about, hey, somebody show me your gums a year later, 2 years later, 3 years later. Here you are 5 years later. You're kind of like an OG patient. You've had this for a long time, and your gums are great.
And I love my smile, and I love my teeth. I do. I wouldn't change it. One of the best decisions I've made in my life was I had the lower done first, and then I was comfortable. I had the lower 3-on-6 done, and then I had the upper denture, and I thought, okay, I'm comfortable in this denture. I'm kind of scared to switch it out.
Yeah.
If it's not broken, don't fix it.
Yeah.
But then once I saw Dr. Roberts, there were a lot of things wrong with that denture. It wasn't straight and such, but eventually, that was my goal to transition. And I'm very happy. Very happy
that.
just to get rid of taking it in and out every day and have to clean it and to be able to get up and brush my teeth like a normal person.
That's fun,
amazing.
right? It just feels good.
Yeah.
And there's an interesting thing. Let's talk about actually, it'll be fun. Read that comment right there, because I know you know who that is. Can you read it or want me to read
Claudette?
it? Yeah, read what she just wrote.
Cried in the parking lot when the dentist told me my teeth were going to fall out. Couldn't believe it. Felt shame, panic, wondering where to turn. Wanted another opinion, even though my teeth were so loose. It was the same with me. I can remember when my teeth were first starting to get bad. I was delivering papers, eating a chicken tender, and I bit into one, and one of my front teeth snapped to come out. And I called my husband, and I was freaking out. Like, what am I going to do? It's not just the back teeth now, because it starts with the back teeth.
It can.
So a lot of people start losing the back teeth, and then you start chewing with your front teeth.
Yep.
And that the front teeth aren't made for chewing. So
that's right. They're not made to carry that heavy load.
Yeah. So, but Claudette, I'm the same. I was the same. I was upset, like in denial, major.
So the maintenance, let's talk about, you said brush my teeth like a normal person. Just walk us through your daily routine taking care of your 3-on-6.
So just get up in the morning and brush, water flosser to get the food from around the gums and the back, and really that's it.
So do you use your water flosser once or twice a day? Twice a day. She pays attention to the rules.
Yeah.
And how many times a day do you brush your teeth? Twice a day. but that's maintaining your gums. Now.
That's maintaining. And I just had my hygiene appointment in Utah, and they did x-rays, and my bone levels are still great. I was worried because of a medication that I just started, but she said that everything looks great.
Good.
So, and this is 5 years out.
Yeah, this isn't like this happened just recently.
Yeah.
We've had this for 5 years.
Yeah, 5, yeah.
That's incredible.
So, yeah.
Good deal.
And that makes me happy. Yeah.
So just a quick reminder for those of you who might have joined late, I'm Dr. Emett in Las Vegas, and we do the 3-on-6 procedure there. And we have a special guest, Stephanie Saunders, with us today. And she is like the OG of 3-on-6 patients. She's amazing. She runs a gigantic 15,000 person Facebook support group, a wealth of information and knowledge here. And she's actually a 3-on-6 patient herself.
Mhm.
So we're really fortunate to have her in the studio today. And I just want to remind everybody who's watching that this is a great time to ask your questions. I know we've just kind of been talking and introducing and getting started, but if you have any questions at all for me, just put them in the chat. I'm happy to answer those. And if you have any questions for Stephanie, put them in the chat. I hope that we get more questions today for Stephanie than I did for myself. So let's see.
Yeah, Jennifer says relatable. I cried for a week when I had to get my denture. Yeah.
Yeah.
Because I mean, it's unknown, and I think my mindset was going into the dentures are for old people.
Mm.
They're not. This can happen to anybody. But yeah.
My youngest 3-on-6 patient is 32 years old.
Yeah.
My oldest 3-on-6 patient is 85.
Yeah.
So between 32 and 85, and you can probably find some patients or some providers that have helped patients younger and even older, but everywhere in between.
I actually have a friend that she lost hers due to a strep infection, I believe.
Oh, really? Okay.
Yes, and in young. So there's so many different reasons that this could happen to any of us.
Yeah.
And at any age, really.
But I think what my younger patients have come to realize is I just don't want to spend the rest of my life dealing with these problems, not being able to talk or chew or enjoy life or being in constant pain all the time. So if it's something where you're like, am I too young for this? Am I too old for this? It's a question of how do you want to live every day?
Right.
We talked about this earlier. Your mouth is the start of everything. Digestion.
It is. Yeah. Yeah. That's where your digestion for your food starts in your mouth.
Yeah.
So, if you can't chew your food, that leaves you open for a number of other issues. I've had people message me wondering that have having stomach issues, and they're like, do you think this could be caused from my teeth? And I'm like, absolutely. If you're not chewing your food properly,
Totally.
Or be able to eat the right stuff, the right kind of foods, absolutely, that could cause issues.
So it can be even more holistic for your health than just your smile or being in pain. It can affect the whole rest of your body.
Absolutely. Absolutely. Yes.
Yeah.
A couple questions.
Okay, we have a couple questions. So how do I find those?
I'll tell you.
Okay.
How is the recovery, and is this a sedation procedure?
How about I take, is this a sedation procedure?
Okay.
And how about you take, how's the recovery? Because you have it firsthand. So why don't
I
you go
do.
first?
So the recovery is going to be different for everybody. But for me, I was working the next day. Now, I work from home right now. But I felt, it was not bad at all. I think maybe the worst part was probably the third day, but ibuprofen and Tylenol.
Yeah.
Really, it's amazing because I'll let him take over, but they keep you numb, right? You do this. So after you're done with the procedure, you all do numbing shots.
That's correct.
And what Dr. Roberts told me is, the way he explained it to me is, the longer it takes to feel pain, the less likely you will. So when you use that numbing afterwards,
And we use a long-lasting
a
numbing.
long light, yes.
Yeah.
So the recovery really isn't bad. From the very first surgery I had was horrible when I just had the extractions and the implants for the denture compared to this surgery. Piece of cake.
Night and day difference.
Really, yeah.
So let's talk about why that could be. The type of extractions that we do for this surgery are atraumatic, means as minimal trauma as possible. So instead of just taking teeth and taking them
And
out,
yanking them out.
we're doing this very strategically because we need to preserve all of the good bone
Yes.
architecture.
Yes.
So what that means for a patient is it's significantly less traumatic
Yes.
to have these teeth taken out. So that's one thing that patients report. It's interesting. You said you went back to work the next day and that you worked from home.
Yeah.
I did a surgery. There's a true story. Wednesday. So yesterday, I did a surgery yesterday. 2 days ago. Sorry, it's Friday. I'm a little confused. Okay, so I did a surgery Wednesday, and I texted him just barely downstairs. Hey, how you doing? Just checking in. And he sends a picture. I'm at work, and he
That's
cleans
amazing.
carpets. So he had
Wow.
full upper and lower. He had 32 teeth extracted, and he's at work today. And he said, "I'm doing great." Now, when you said third day or is usually the worst, it is. It totally is true. And I tell everybody, listen, if it gets worse for a couple days and Sunday is your worst day, I do most of my surgeries on Wednesdays. That's a normal thing to happen because inflammation picks up, can bring discomfort and pain. But most patients, by far most patients, if they work, are back to work on Monday.
Yeah. Yeah.
That's a very normal thing. They're not
Mhm.
they're not having to take extra time off. So
Right.
when we talk about the recovery being easy, we have tons of videos. I have lots of patients testimonials. And here's somebody live right now telling you
Yeah.
that is totally a true experience.
And another thing too that when you were talking about, if you just go in for normal extractions or implants, yeah, they do them so fast. I've seen people bruise.
Oh yeah, the big heavy
2D
bruising and
max. I was expecting the worst, but I had very little swelling and no bruising.
that's how it
with
should be.
this, yes.
So let's talk about the second part of that question, which was, is this a sedation procedure? So in my office, this is a sedation procedure. I am aware of a few patients or maybe a few providers who are doing components or parts of surgeries that aren't fully sedated. But as a blanket statement, I could say most of these procedures are done under sedation.
Yes.
Now, what we use traditionally is general anesthesia. So we bring in a sedation provider. You will be intubated. That's a little tube up your nose and down your throat. And that way you're completely asleep and comfortable the whole surgery. You have no idea it even happened. And it allows us to work as efficient as possible. We're not having to stop and say, hey, you're doing okay. Do you need a break? You just get to sleep and we just get to work. And that makes the surgery much easier for you and much easier for the surgical team.
And when you wake up, you have teeth.
Yeah, you wake up with teeth.
You
It's
wake
amazing.
up with teeth. Yeah.
I've been working hard for the last 6 or 7 hours, and you just had a nap and you woke up with beautiful teeth.
Yeah.
So it's
Yeah.
really
You can't beat that.
it's a wonderful thing. So is every patient a candidate to be sedated? The answer is no. But that's why you meet with your provider. You're going to go through a very extensive health history because this is an elective procedure. So we want to be as safe as possible.
Mhm.
And but I can tell you that every surgery I've ever done for 3-on-6 is under full sedation. So I hope we answered that. If there's another part you'd like to ask, feel free. There was another question here. How long does the long-lasting numbing last? As a rule of thumb, every patient responds to local anesthesia differently. Some patients burn through a little quicker, some a little bit slower. But we use one that has a intended rate of about 8 hours. So we get you numb at the beginning of the case, we do your surgery, and then we numb up at the end of the case to give you that little 8-hour boost. So some patients may get home and a few hours later, they're like, hey, I'm starting to come unnumb. That's normal. They have a higher metabolism. They're burning through it. Some patients will come in the next day and say, I was numb well into the night.
Yeah.
You're welcome. Like, I mean, I'm doing my best I can to help keep you numb as long as possible. So yeah, we definitely use the longest lasting stuff we can at the end of your case to help you stay comfortable.
Mhm.
I usually have nausea with anesthesia, but did not with this surgery. I have the medical answer for why that's probably true. So a lot of patients have that same experience.
Yeah.
They say, oh, I traditionally wake up from anesthesia. I'm not feeling very good. It's a hard thing for me to wake up. I'm sick to my stomach. I have nausea. And that's pretty uncommon for this type of procedure. And here's why. At the beginning of the procedure, we take you pretty deep for the really stimulating things like teeth extractions and implant placement. But towards the end of the procedure, we're lightening you up the entire way. So I tell patients at my office, you may hear the radio, you may hear my dumb dad jokes, you may hear us talking, but it's because we've been gradually waking you up for an extended period of time. And so the wake up is very different. And even the anesthesia providers that come into the office, they go, it's so nice because it's a little bit of a longer procedure and we're just gradually waking them up all the way to the very end. And so the wake up out of this type of procedure is frequently much easier than your traditional experience.
And also, like, because my niece and nephew have had the surgery too. I think once they wake you up, if you feel nauseous, they can give you something before, right?
Yeah,
So
we're
they
really
can give
proactive
you-
about that too.
It's an incredible. There's somebody had a question about the heart.
I think they made a comment about the
They said
heart.
The heart health.
The heart health
The
is
heart
a
health.
biggie.
Okay.
Yeah.
Okay.
There is an Instagram comment. It's a question for Stephanie.
Okay.
Are there any foods you avoid now with your fiance?
Okay, repeat the question so that everyone can hear it through the
Are there
microphone.
any foods that I avoid? I do. But the only thing is like hard almonds. Now, there for a while, I was chewing ice, but I was low on iron. And I'm pretty sure that you're not supposed to chew ice.
It's okay. Answer the question.
Yeah.
I don't want to influence this at all.
Almonds and ice are the only two things that I avoid. Now, tell me, is there something that you're supposed to avoid?
Mhm.
Okay. And I just do because, just because that's just me.
And that's okay.
I don't want anything to happen. These teeth are so strong and hard that you could probably bite rocks with them. Really.
Yeah.
Really. But almonds and ice is the only thing that I avoid
That you avoid.
personally. That's a personal choice. Yeah.
And that's okay. I love that for you. I'm going to tell you a story. I'm sitting at a restaurant and a patient looks at me and says, Dr. Emett, look at me just chewing ice.
Yeah.
And her big thing was she wanted her 3-on-6 and wanted reliable teeth because she hadn't been able to chew ice for 20 years. And I can promise you right now, she's out there chomping ice.
Yeah.
This woman loves her ice. And it's totally okay. But making a decision, being aware of your teeth is important too.
Right.
And so you've made a comfort decision, but the goal is that we give you teeth that you could use just like normal teeth. So is it healthy for a normal person with normal teeth, just normal teeth, to be chewing ice all day long? The answer is no.
Yeah.
I mean, you're going to break down your teeth faster. You can have some issues. That's the truth.
Yeah.
Somebody who's just like opening up a beer bottle with their teeth, we're probably going to break our teeth.
That's what I was going to say. Now you can't, I said something about biting rocks, but you can't take and open.
But they feel strong enough they could do that.
I was making a point. They feel strong enough. Yeah. But
not. Let's not.
Right. Let's be real here.
Let's be real.
Yeah.
So that's a good perspective. And I'm glad that you have some, put some limits on what you feel comfortable doing, because every patient should do that. They should evaluate how it feels and decide that's what I like to chew, that feels comfortable, because these teeth do feel different than normal teeth.
They
That,
do.
that was on my list. I wanted to talk to you about that. In what way would you say, or your experience of chewing is different than with natural teeth?
Well, honestly, Doc, I've gotten so used to them that I don't remember what my natural teeth feel like.
That was the perfect answer, by the way. Good job.
Like there may have been an adjustment period at first, but now this is my normal. So yeah.
Good.
Like
This is how it is now.
yeah, this is
Okay.
how it is. And I will say, this may be going too far into it. The first set of teeth you get from the first set to the second set to the finals, they're all going to feel a little different.
Yeah.
And that's because of the material, right?
That's true.
And your first ones aren't segmented.
That's true.
So, but the final teeth are amazing. And trying to explain that to my niece and nephew, because they're, but you do get used to them.
Good.
You do. So like this is, yeah.
This is just your normal.
It's normal for me now. There's
I love
no,
that.
yeah.
Okay, we have a few more questions. So Sarah asked, can the procedure be done on a breastfeeding mother? How about I take this one and then
Okay,
we'll
yeah.
go to another one. So that is a question that needs to be addressed by your provider and by the anesthesia provider. The reality is, if you're breastfeeding, whatever we give you by default can get passed on to the baby.
Yeah.
So if it's a situation where it needs to be done, maybe there's indications that it's time to get this done now rather than waiting, you would need to do things like prepare ahead of time, have plenty of milk ready for the baby so that you can go for a period of time with them not getting anything from you. And then the provider and the anesthesiologist will talk to you about doing a pump and dump. So you're going to pump that out of your system and get rid of it without giving it to the baby. So you can do sedation, you can do procedures on a breastfeeding mother, but I think that's a decision that needs to be made individually. My preference in my office would be, let's wait.
Yeah.
Unless there's an inherent reason, an infection or something happening. I want to take the path of least resistance and the easiest option for everybody involved. And if it's just a matter of waiting for 6 to 12 months, let's wait.
Right.
But if you've got an infection, you're in pain, that's probably a bigger risk to your overall health and being able to take care of your baby even than just having the surgery done and doing it in a smart way. So definitely a good conversation to have with your provider and the anesthesia team. How difficult, John says, how difficult is it to remove implants from previous dental work? I'm having 4 removed. I can handle this one.
Yeah. Yeah.
Right. So you don't need to take this one. Okay. I have removed lots and lots of implants from patients. I've had some patients I removed. I have one that's coming to mind right now where we removed 8. They were in very poor positions in the mouth. They weren't usable. Removing an implant is actually relatively easy. We hope that an implant gets really osseointegrated and it's really inside the bone really, really well. And those types of implants can be problematic. So there's lots of specialized instruments that I have to help me remove implants. I have had 1 or 2 implants in my career where I went to remove it and it's so integrated into the bone, I just left it. And if I can leave it, I will. If I can integrate it, I will. But I think most of the time we run into implants that are in such bad positions and in such bad bone that taking them out is usually pretty easy. So what you do is you remove the components off the top of the implant, if there's a bridge or a crown or an abutment, and then we have the instruments to engage the actual implant. And it's kind of like screwing a screw out of wood, but just back it back out of the wood. But if we can't get it out, if it's one that's even really integrated into bone and it has to come out, we have an instrument that can do that. And it's essentially just a drill that is just slightly wider than the implant. It kind of just drills down along the implant about halfway, and then that little implant can come out. Okay. So we try to take those out with as minimal bone removal as possible. But yeah, they totally can be removed. Having 4 removed, that's really, don't be worried about that. If your provider said, hey, we need to take those 4 out, I promise you your provider has the skill set, the ability, the instruments to do that and do it safely and do it correctly. It always is alarming to me sometimes when I go to take an implant out. Someone's like, oh, I got that 3 years ago at such and such place or whatever. And I hook onto it and it just comes out super easy. It was just a poorly placed implant in bad bone. Or we often see implants that could have been this long and they were only this long. So oftentimes taking them out is pretty simple because they just weren't properly thought through in the first place. I hope that answers
the implants that I had taken out were mini implants. I had
and those
on
come
top.
right out.
Yeah. And those were taken out and I had regular put in.
So let's talk about something real quick. You brought up a mini implant. Mini implant versus an implant we would use for 3-on-6, they're different. Yeah. They're just a different kind of implant. Yeah. A mini implant is just like the term implies. It's a really small implant. It's tiny. They're very small.
Very thin and
real narrow. Oftentimes they're really short. They're just not made to withstand really heavy chewing forces.
Right.
So taking out a mini implant, obviously the smaller the implant, the less bone it's integrated with, less surface area. So it usually comes out pretty easy. So, all right. John, you're totally welcome.
You're welcome.
Good. I love that.
Sarah said thank you too.
Okay, good. You're very, very welcome. Okay. So we've talked a little bit about the daily maintenance that you have with your 3-on-6. Mm-hmm. Let's talk about the long-term maintenance every
Okay.
6 months. Because you mentioned that a minute ago or a
Yep.
while ago that you just had one of your checkups.
One of my
Walk
yeah.
us through a hygiene appointment for you today.
Yeah, I just had hygiene, and so they did some, is it bite wing, or they did some x-rays on me.
Yeah.
Yeah, like the bite wing things.
You know too
And-
much. Yes, they're called bite wing X-rays.
And yeah, and it's just a normal hygiene. So it's like if you have, just like when you have regular teeth. So they go in, and if there's any plaque or anything, they'll scrape, floss, and then they polish your teeth.
Was it painful?
Not at all. Yeah, not at all.
Way easier than like deep cleanings and SRPs.
I look forward to my hygiene appointments, because I'm like, oh, they're going to polish me. They're going to polish me up. And
Get them all
yeah,
pearly white.
Yeah, get them. Yeah, I do. I look forward to it.
Hey, while we're on this subject, can your teeth stain? It's a trick question. I don't mean to put you on the spot. But I wanna
So
ask.
here's what, from my experience, the temps
Oh yeah,
tend to
temps.
stain. If you're a coffee drinker or tea drinker, the temps do.
Yeah.
These zirconia teeth, I mean, I don't think they, maybe a little,
They really can't stain.
but
You can get buildup on them, and then staining coffee and tea can stick to the buildup on there,
as long as you're keeping them clean
Yeah,
and
but I was just
doing your
saying.
hygiene, you know.
and then it can just polish off at the hygiene appointment.
Yes.
So you really can't stain zirconia.
Yeah.
But the plastic teeth you can. The, temporary
plastic,
teeth.
yeah, because
We
those,
see that.
because those are PMMA, right?
Uh,
Or like
they can be. Most of the printed ones now are ceramic reinforced resin,
oh, okay,
and so they're a little bit stronger, but still they stain.
okay.
Even if
yeah,
we
they-
glaze them, they just, we're relying on plastic teeth for 3 to 4 months,
right,
and it can just stain over time.
right.
I always love when I put a second set in a patient in the same shade as their first set, but they look brand new and clean. Like,
Yeah.
oh, these look, they're such a better color. And it's like,
Yeah.
well, they're
It-
the same color.
Yeah,
They just aren't stained anymore.
yeah. That's something that when choosing a shade for my niece and nephew.
Well, let's talk about shade. This is a great segue to talk about shade.
Yeah,
What shade are your teeth?
mine are BL2. Mine are, yeah,
Do you know what BL stands
which
for?
is bleach,
Okay.
a bleach shade.
Bleach
So
too.
with the BLs, with the bleach, there's a BL1, which would be the whitest shade.
That's correct.
2, a 3, right? And there might be a 4.
Depends on which shade guide you use, but then we're going to go into our 1M1s and our 1M2s.
Okay.
So you have a true bleach shade.
Okay. And then the most natural white shade would be a B1.
That's correct.
See, I need a job, doc.
You're hired. Come
No.
to Vegas.
B1 would be the most natural white shade. And then A1 is what?
A little bit darker. There's a little bit more of a tan undertone to A1. A1 can be a little bit more age appropriate.
Okay.
If
Yeah.
somebody is in their 70s and they walk in and they don't want people to just notice their teeth right away, we might want to choose a shade that's a little bit more age appropriate.
Yeah.
B1, I call the timeless shade. You can have B1 now. You can have B1 when you're 150. It's going to look amazing.
Yeah.
I love B1. I would say most of my patients are in B1 or maybe 1M1.
Okay.
And I like 1M1 because there's a lot of vitality built into that shade. But your teeth are beautiful. I love
Thank
your shade
you.
you chose.
Yeah.
And every patient gets to be involved in making that decision and picking the shade of teeth that they want.
Yeah. And some people may say, well, they don't look natural. Well, it's a personal experience.
Yeah.
I wanted Hollywood white teeth, you know?
I have
So-
some patients that walk in the door and say, I want to walk into a room and everybody go,
Yeah.
wow, look at your teeth.
I want the whitest
Yeah.
possible. Yeah. But that might not be what, somebody that's 85 want. They may want, like something more natural, but well, if I'm going to pay for new teeth, I want the
You're getting what
whitest,
you want.
whitest.
It's
Yeah.
totally good.
Yeah.
So we have, let's talk about in plastic teeth, what shades we have. So technically the company makes 4 shades. They make a bleach, which is just like plain white.
Mhm.
They make a A1 and an A2, and they just barely within the last year made B1.
Okay.
Now I can tell you that 95% of my patients are in B1. It just looks so good in the plastic. And I have some patients like, I want white. Well, we can look at doing the bleach shade then.
Yeah.
I don't even show A1 and A2 to most of my patients. I really just don't. Now in plastic, we're pretty limited. We have those couple of options.
Yeah.
But in final zirconia, we have tons of options. That's where we can open up the entire universal shade guide in dentistry and find the shade that matches for the patient. But there's some cheap tricks we do in dentistry to help identify a shade that's going to look good in a patient. And I'm going to tell you what one of those is right now, so you'll always know it. We look at the whites of your eyes. And if somebody has really, like look at the whites of your eyes on the screen.
Yeah.
You have really whites of your eyes. You can get away with really white teeth. They're going to look great. If somebody doesn't have really whites of their eyes, maybe they're a little bit more yellow, the teeth will stand out a lot more against those. So one of the cheap things, easy things we do is we look at somebody's eyes when they come in the office, and I'm talking about their teeth, and I look at the whites and go, all right, I have an idea of where we can go.
I've heard that, that you match them with the whites of your eyes.
But it really comes down to patient preference, like what that patient wants. So Claudette says BL2 here. That's perfect. I'm going to be 66-year-old soon. I want white teeth. I love it. That's perfect. And patients come in all the time like, doc, I've never had teeth. I've never had white teeth. I've never had nice teeth. Give me some white teeth that I can just feel so confident and proud about. So that's awesome.
Yeah.
Some of us are lucky enough to have a bright white
sclera.
Yeah. So there you go. So way to go using the correct words. So that's just one of the things we can do to help pick what the shade should be. Okay. So again, we've got about 15 minutes left here. Any questions that you have for Stephanie about her journey, about why she chose 3-on-6, about what led her to this spot? I mean, this lady runs a support group with 15,000 members. So her expertise goes far beyond just the 3-on-6.
Yeah.
So if you have any questions for her, now's a great time to ask them. Or of course, you can ask me as well. But let's go on to some other questions that we had ahead of time. Okay.
Okay.
So some people may experience a setback during their procedure. I think we're referring to maybe an implant failure.
Yeah.
We're referring to some things that can happen. So first off, what would we say to somebody who may be experiencing or has experienced a setback in their 3-on-6 treatment?
I went into my experience with low expectations, and that's not because that's how I felt about Dr. Roberts. I just going into the unknown and not knowing really what to expect. I didn't want to set the bar so high that I was disappointed because I really didn't know what I was getting myself into.
Okay.
And so I mean, this is a tough question.
I know.
I think if you go in with expectations that your procedure is going to be like someone else's that didn't have any trouble, or you expect it to be perfect, I mean, things can happen.
I think that's well said. I mean, I have patients that have had an implant fail. My failure rate in my office for implants, and Tiffany can verify this if she's watching or going to watch. She told me the day it's at 1.78%. That's really low for a national average, but it means that implants can fail. And it's so my advice for patients in that situation is it is just a small setback. Stay focused on the most important thing is a good foundation. If your provider says you have a failed implant, it's okay. This is not a rush. It's not a race to the finish. It's a good quality outcome.
And my niece had one fail.
There you go.
And so, I mean, it can happen to anybody. There's various reasons that they can fail, but yeah, it's a minor setback, and don't let that discourage you from the end product, yeah.
Okay, good advice. We have a question from somebody. It says, from Mia, what made you pick the 3-on-6 over the all-on 4?
Okay, good
That's
question.
You.
So coming out of, or having the denture, the snap-in denture, I knew from what I knew, if I were to get the all-on 4, the prosthetic was going to be similar to that snap-in denture, just permanently implanted. Okay. I wanted less material in my mouth. So I didn't want anything like a denture So the less material for me, the better. So that's why I chose, because I knew the 3-on-6 was only going to be the teeth only, not the full.
No fake gums.
No fake- yeah.
big thick prosthetic. It's
Yeah.
not covering your gum tissue. It's just the teeth.
Yeah.
And how does that? When you feel the back of your teeth with your tongue compared to like your dentures, just talk us through that.
It feels like it feels like normal teeth. Yeah, they feel like normal teeth. So, but yeah, and I'm not down in the all on 4, but it is the prosthetic, I think, because it's one arch, it has to be so thick to prevent it from cracking or breaking. Am I right on that?
That's part of it. Yeah.
So, and that's just not something I wanted. I wanted to get, go back to as natural as possible, as natural feeling.
Okay.
So,
I think you answered that very politically correct. You did a great job. So another question that I had written down for you ahead of time was, what do you see with this big Facebook group that you run and all of your outreach and your experience? What would you say you see as the top 1, 2, or maybe 3 questions that people have about full mouth restoration? What is it they're most concerned about?
The number 1 is the financial aspect of it.
Okay.
So how do you pay for this? And there's most people.
So it's a big question.
Yeah,
it's hard. It's expensive. Let's just say it. It's expensive.
Most people finance it. I mean, there's not very many people that have the cash to put down for this. So, yeah, financing. Another thing is, what was the question again? The biggest question that I get. Yeah, the biggest
questions you see.
Yeah, the recovery time. People want to know, is it painful? And how long are these teeth going to last me? I think.
Okay.
So the financial part of it, is it painful? And if I do this, are these teeth going to last me the rest of my life?
Let's answer that. How do you feel about that?
I mean, I think, yeah.
You've had yours for 5 years.
I've had mine for 5 years. And if I didn't have faith or confidence that they were going to last me a long time, I wouldn't have done it,
And you wouldn't be out here talking about it.
Yeah, because I don't want to do this over.
Right.
I don't think anybody does.
No, we don't want to do it twice.
So,
and true testament to that is not only did you have the surgery for you, but your nephew.
My nephew.
You had him undergo the procedure, and just barely your niece.
My niece. She's about to get her finals on Monday.
On Monday. That's why you're here in Las Vegas.
That's why I'm here.
Because you guys were up in Salt Lake at the 3-on-6 office.
Yeah.
And we were so lucky you drove down to Las Vegas to come down here and see us.
Yeah.
I wish I could say you drove here just for us. She came here for her vacation.
This is the first time I've ever been to Vegas. And so I thought, well, we have to be out here for a while. Let me reach out to Dr. Emmett.
I'm so glad you did.
Yeah.
It's
been a fantastic experience. It really has. I'm glad that I got to come meet you all and look at the office. And he's got a beautiful office.
Oh, thanks. You're so sweet.
Yeah.
Okay. So next thing I have is I want to talk to you about advice that you have for somebody who is considering full mouth rehab, maybe not even 3-on-6. They're one of these members in your 15,000 support group that are like, I was told I need my teeth out. I was told I need something. And they're just at the beginning of this journey. Let's talk about advice that you could give to that person.
Research.
Oh, I love that.
Take your time. I think when we find out that we're going to lose our teeth, we panic and we're like, I got to do something. I got to do something. But you cannot rush this. Don't go into your first consultation and pay or put a down payment. Go to a couple consultations and look at all your different options. Take your time. You rush into this and it's likely, I mean, I've seen so many people that they just want teeth and they want to do it so bad. And they bite at the first consult and then they wish they wouldn't have. Take your time and weigh out all your options. Look at all the different procedures. If you go in and meet a provider and you're just not comfortable, leave and find someone else.
It's
So,
it's a relationship.
it-
You're
it
going to
really
be with this
is.
provider for a while.
I think when you meet a provider that's for you, you'll know.
That's smart.
It's almost like your love life.
You kind of walk in, you're like, I get along with this person. This
Yeah.
is going to work out. And
Right,
like,
yeah.
you need to like the staff. You need to like the office.
Yeah.
You need to like the provider. You need to like how they make you feel, because this is not just one appointment and you go away. This is a consultation, a smile design session, a surgery, a 24-hour appointment, 3 months of recovery, a 3-month appointment, a finals appointment, and maintenance. I tell people, like, we're in this for a relationship. now.
You develop a relationship
Yeah.
with your provider. You do. And it should be you should be comfortable enough to where you can walk in and talk to them about anything, your fears,
It's a big-
questions. Any questions shouldn't be off the table.
Something so fun happened
So-
at my office yesterday when you were there.
Yeah.
And another patient came in for their appointment.
So I wanted to tell this story
Okay, you
because
tell it.
so I'm sitting in and we're wrapping up, and I look out the door, and here comes this patient.
You're gonna read
Like, she's like,
like dancing down the
and I'm
hallway.
like, oh my gosh, I've never in my life seen this. This is amazing. And because she just had surgery, and I'm like, this is incredible.
It was so fun, huh?
Yeah.
And
so like you guys, they're great out here, and it just showed. I didn't need any proof of what I already knew when I walked in, but having this lady come in, I'm like, this is awesome.
and it's fun
So-
because that's a patient that was dental phobic. The first time I met him, they didn't want to be there. They didn't not want to be at the dental office. They did not want to sit in a dental
Beautiful
chair.
woman. Yeah.
And now she just can't stop smiling. She
Yeah.
runs into the office. She just loves that whole experience. So
oh, what a nice,
Yeah, that was
what an
so fun.
incredible person.
So
yeah.
I'm just going to piggyback real quick on your research comment. I think that is so wise to share with people. One of the biggest challenges we have at our office is helping people make good decisions. And so we tend to overeducate, but it's sad how many patients come to see us and say, well, I went to this office. They didn't even tell me this existed. I didn't even meet the doctor. I sat there with a treatment coordinator.
Yes.
They didn't even tell me about these options. And they come to our office and we spend 45 minutes, an hour and a half, whatever it takes to go over every option that you have, help you make a good decision. But I love that you told the patient to research, because go find the solution, go find the answer for yourself. Don't just take it from a provider. Do some research and reach out to people like your group, your support group.
Yeah.
Reach out to patients that have had the surgery done.
If you go for a consultation and you don't see the doctor, run.
It's an interesting perspective.
Because I've had people message me that tell me about their consultation. They didn't even see the doctor. It was ran by the staff, and I'm like, and then they want you to sign up, or they want you to put money down for a procedure, and you haven't even met the doctor.
I think that's
Like,
so
are you
weird.
nuts?
Because I need
Yeah.
to look at every x-ray and look in their mouth. We do an exam at the consultation and they'll say, they didn't even look in my mouth at the other place. Well, I kind of like to look in your mouth so I can help you make a decision about what might be best for you. So we're getting really short on time right now. We've got about 5 minutes left. I just got the cue from the team. We have one more question. We're going to address that, and then we're going to just kind of close out. So what's a better option, snap-in denture or 3-on-6? Stephanie.
I mean, I'm going to tell you 3-on-6. Because
You've had both.
I've had
You're
both.
a unique situation.
I've had both. The thing is, with your snap-in denture is not a bad option. However, you've got to think about there's going to be maintenance for that. So it's not just the one-time cost of having surgery and getting the denture. You've got to keep up with relines. There's bands that go around the on the denture to keep it snug.
The rings.
The O-rings have to be replaced. That's not cheap. The first year after I had mine, I ended up almost $2,000 out of pocket, and I was like, this is not what I signed up for. I don't want to have to continue putting money out.
And this is still something that you need to remove every night
And clean.
and clean and leave out of your mouth and then put back in the morning. This is not even though it's a snap in, it's not fixed permanently.
Yeah, right. Yeah, the maintenance,
So-
it's more time consuming.
Yeah, but good question. That was a valid question to ask. So listen, we are at the tail end of this conversation.
Okay.
I just wanted to genuinely thank you for reaching out and coming to Las Vegas. What you are doing for patients and being a support for them, and there's no judgment, there's no push onto one thing. Your perspective on true patient care is refreshing,
Right.
and I really appreciate all that you're doing for patients.
Well, thank you. It's been an amazing experience. I want people to trust me, and not think that I'm trying to force something on them. I want you to make your own decision on what's best for you, because what's best for me might not be the same what's best for you, you know?
Yeah.
So, but yeah, if you're in Vegas,
I appreciate
please
that.
go to All Out. These guys, I mean, the office is beautiful. The staff is amazing.
Aren't they
This
so
guy's
great?
amazing. This has been an amazing experience.
Well, thank
It
you.
really has.
Thank you.
And if I'm out here again, yeah, I'm gonna.
Come back to Vegas.
Yeah.
Well, it's been a pleasure to have you and to do the live today. Thank you so much. Again, if you are considering full mouth rehab, don't hesitate to reach out to a 3-on-6 provider. Reach out to your nearest 3-on-6 provider. And of course, if you're anywhere near Las Vegas or you'd like to come see us, you can always reach us at alloutdental.com or 702-710-9006. We would love to see you in Las Vegas and help you on this journey. Again, Stephanie, thank you so much.
Thank
and
you.
thanks for attending today. We appreciate you guys.
Bye, guys.
Bye-bye.